choice as compared to the other one. Okay, so the continuous program, what you have to do, you have to educate your staff. Okay, and staff education and training may be in just training, in time training. It should not be. So not too far in advance of survey. Like you cannot do, we are going for the accreditations for 3 after 2 years, and I'm going to start the preparation now. They will forget, and not close to time. So you will give, sometime it happen, most of the time they give you direct books and they say after 1 month there is a survey. So in both way they are not good. So you have to make a plan, and a good quality team, they always made a very good plan, and they divide into the task into the different portions, and then follow it, and then go for it. So now again I'm going to take some help from somebody, if it will be added just for 2 minutes. If you want to add a new, you receive a new medication in your pharmacy. Okay, so how you will inform the hospital, hold the physician and the what you call the staff? Just give me, or any information. So what kind of tools you will use it, if anybody want to share it? Any medium? Okay, so we say, like, if you want to educate your staff, okay, so what you have to do, you have to either make a newsletter, pocket guides, or quick reference booklets. You have to do a classroom training sessions. Okay, you can use a teleconference technology, internet or internet training programs. Okay, like your screen is always running for such programs, either through your internet or intranet. And self-study modules, you have to put the computer-based learning programs inside, like question answers or something in already prepared, and then they can play like flip cards or something. They can go and play and learn from here. So there are different kind of tools, and more innovative, more creative you will be, the more benefits you will get from the staff education, which is very important. So education program, either it could be 1 year pre-survey, either it could be year 2 survey year, or either 3 years post-survey. This whole depends upon the size of your organization, okay, and kind of accreditation you are looking for. Staff recognition, this is very, very important. Okay, and I will take the opportunity to say, everybody of you who are working on there, the staff recognition, each staff is very important. Okay, so everybody want to get on a higher place, or everybody want to be recognized. So a good leaders or good managers or supervisor, whosoever they have to develop a merit properties over there. The more minimized you will be for professional jealousies, okay, and the positive culture and the positive attitude you will inject in your staff, it will be improve your your department, your organization. So we say that we have like an exit interviews, but in exit interviews, even the people, they're telling truth, or you are asking good questions? No. So the staff recognition is very important. Until you will not do it, you cannot achieve that particular task, whatever you want. And timely recognitions, this is also very important. Doesn't mean somebody did the things over there and you are gonna forgive it, or after 2 years you're gonna remember for that. So there are different type of things, like you have awards, you have certificates, you have like the posters in the pharmacy or in your department, or you have the gifts or something like that. So recognition in another way, sometime believe me, just some motivational words for the staff is enough, rather than to give them some money or financial or something like that. So you have to identify the needs, and you have to do that one, and positive attitude everywhere, that must be promoted. So survey procedure plan, we will go for that. You get understand everything, you did education, you done everything, then the survey going to be happen. So what you have to do, the first step in survey preparation is understanding the applicable standards and criteria. So you have to plan your procedure, should be planned in advance, that what they will do, what the surveyor will do, what they will, where they will go, how many people they will be there, and what policies, what procedures they have to check, and where they will do the tracers. This everything should be clearly done in your tasking area. Then you have to prepare yourself for the survey application, for the readiness activities, for the space and planning and hosting. You have to make a command center where every day you're going to sit and start the meeting and then go for all the workers wherever the deficiencies are there, where there are improvements over there. So that is very good. The command center operation is the key for when such kind of activities are done, are going on and done that one. Then come the post-survey procedure. As discussed by Dr. Faisal, that during most survey, the surveyor conduct an exit conference prior to leaving the facility, and they will inform you your positive and your negatives. So how to deal with that? If you got the JCA certification, you don't have to be what you call that, jumping with the joys that, oh, we got it, and you forget all your deficiencies over there. So you have to make a good analysis between the goods and the bads for you get from the surveyor. Then the post-survey procedure is that if the preliminary findings are favorable, there are still things that the organization will need to do. As I told you, debrief as soon as possible after the survey, evaluate the survey process, celebrate completion of the survey, summarize finding and recommendation, make plans for post-survey. Okay, and there could be the question come from this slide, like what you will do after the post-survey, and we will discuss that kind of question in our later slide. Okay, as I just said you, the post-survey procedure is difficult program, is oversight, action ensured that are fully implemented, evaluated, revised necessary until full compliance is achieved. Okay, there are some organizations that are being used in implementing their safeties. There are national quality strategy. It has 3 aims: better care, healthy people, communities, and affordable care. Then National Quality Forum, the main 3 areas supported by the NQF are public reporting, provide safety practices and error disclosures. And then, of course, the JCI. It established national patient safety goals and update it annually. Fine. So with this, we done with the practice, with our presentation. And now I'm going to go for some practice questions from this chapter or this topic. So I'm going to take a 1 minute of break. And is it okay? Am I audible?
Yes, you are audible, Dr. Khurram.
Okay, fine. So what we will do, we will study the question together. Okay, and we will then go for all the options together, and we will say one by one why the options are not good and how to select that option is. And that could be a small practice for your CPHQ as well. So
okay,
like,
sure.
as I told, sorry?
No, it's okay.
Okay.
Your answer is...
So yeah, it's okay. I should. I intentionally ask this is the right question because I want to know that why the other is wrong. You got my point? Yes. So
yes.
Like as I discussed before you, what is the deemed status refers to. So I make my slide descriptive. I can put the pictures inside or colorful stuff inside, but it is not required for this topic. So like I told you that this question can come. Sometime I should not say, I mean, it came to me or it came to them. It can come. Okay. So like what is the deemed status refers to? The option is accreditation equivalency with a center of Medicare or medical services. Physicians who have been reported to the national practice, of course, it cannot be. It could not be a deemed stated by a person. Or surveyor who work for both an accrediting body and a healthcare organization. So the right choice in among these options is a healthcare organization that passes the Centers for Medicare or Medical Services survey, appointed by a national, as I told you, that the CMS, they're going to appoint a organization that you have to conduct that survey. And if it is passed, the deemed status will be given to be an accredited status. Okay. So this question you have to be keep in mind. It can come. Okay. And you can read my slides for the further justification. Okay. Anybody who want to read the question from the participants, or I'll read it. Okay.
If you allow,
so the question is, yeah, okay, go ahead, Faisal, Dr. Faisal.
Wait, just 1 minute. I think one of the audience, they are asking that it cannot be D. Can you go back to the previous question? Dr. Khurram, yeah. Yes. The audience are asking it cannot be D. So can
surveyors,
you explain?
Surveyors. It is not surveyors who work for both accredited body or healthcare organization. No, it is not a person. It will be nominated by the national, the organization to be given to our accrediting company. It's not be a single person. Okay. So the right answer will be for the C. Okay, so the next question is voluntary accreditation is a primary requirement for most healthcare organizations. The most important aspect to consider when evaluating each type of accreditations options are the frequency of the participation in accreditation evaluation or survey, the reputation of the accrediting organization and the public familiarity with it, cost effectiveness of participation, and the last one is D, the program offered and the accreditor's commitment to improvement. Fine. So why we select this one? So the volunteer accreditation is a primary requirement for most of the healthcare organization. So the option D is more viable and more suitable for it. Then another question is accreditation and regulatory recommendation should always be considered. This is the Dr. Faisal question is. Faisal, can you please, brother, read this question and the options?
Yes.
If you are with us. Yes, go ahead, please.
Yes, I'm with you. Accreditation and regulatory recommendations should always be there. Option A, the highest level of achievement for an organization.
Stop
B,
here now.
when developed. Yeah.
So you understand what the discussion we did at that time with Faisal. This is the same question, isn't it, Faisal?
Yes.
Please go ahead. The other options. Yes, please.
When developing process with data stream analysis. And next is in the management of utilized resources for patient care evaluations.
Patient care evaluation.
And D is the
we should consider minimal rather than optimal standards for an organization. Like if you so if you got the like JCI, you got the JCI, you should not say, oh, we've done it. We killed it. We did everything on it. Nobody will take 100% on it. There will be something you have to focus on it, isn't it?
Obviously.
Yeah, you have to take it as a minimum.
Obviously.
I mean, don't take
survey always give you.
Yes.
Minimum.
Yeah, exactly. There is always room to improve for that. Even for the past processes. If they say your process is past, even then there will be something you can innovation creation. See? Like if you invented a process, it doesn't mean that it's done. It means it is improving. Like I'll give you the example, like the Corolla in 2010 and the Corolla in 2020. What is the difference between that? Do you think is that same? No, there's a big difference. So if they will be satisfied on that, like 2010, we made the best Corolla car, or we made the best Camry car. So they will be done over there. So they they took it as a minimal. They took it as a minimal and they try to make it more innovative creation. You know that the tape recorder has been replaced by right now they are replaced by first by the CDs, then by the DVDs, now by the touch screen things. Okay, so we have to take it as a minimal rather than optimal. That will be the best option for this question. Then I told you recall question. It's a very, very simple. AHRQ sponsored survey facilitated assessing the organization patient safety culture. What AHRQ stands for? Easy, but at that time, if you don't know AHRQ, you will, because most of the time when we are studying in the CPHQ exam, we go for JCI, we go for AHRQ, we go for like this. We never ever go for the exact detailed name of that organization. So sometime this question will come over and then you will be regret over there that, oh my God, I lost that time. If I will read that one, it will be very easy. So simple answer is the Agency for Healthcare Research and Quality. Another question is the National Quality Forum endorsed for safe practices to assess, develop organizational patient safety cultures. One of the most important elements needed to create the culture is the option A is right. Why? Because you have to know what is NQF forum. As I told you in my last slide, as I told you, see, if you didn't focus like this, I make it by myself as a descriptive slide. So I write it for you here that there are three supported there. They are provided safety practices and error disclosures. So if you didn't read that one or you didn't properly focus on that, you will not able to answer that question. Okay. So NQF identifies safety risks and intervention to reduce the event. Okay. The other option was measuring patient satisfaction after a risk intervention. Of course, it's not there. Leadership from external suppliers assisting the culture structure. Of course, it's not there. Training patient to abide by the safety culture requirement. Of course not. So that's why I'm saying that whenever you are reading the question or when you're reading the slides or when preparing for it, try to be calm down, read properly, and do read whole abbreviation. Don't go for NQF. You must know what is the NQF is and what is properly features are. Okay, so the take home messages from this discussion, and it's a thank you very much for all you guys who supported in between that one. Hope it will be good. We have to understand between the accreditation, regulation, certification. We should know what is the deemed status and certification, what is accreditation survey readiness, how to prepare it, what is continuous readiness, what is not. You have to talk about all this. Then most important thing is that how to accreditation. During that one, you educate your staff and role of the leadership. With this, I will conclude my presentation, and inshallah, thank you very much. Wish you good luck for your exams, and you can read these slides as in a descriptive way. It will be good for the preparing for this topic, and inshallah, I'm going to share it with you. Thank you very much.
Thank you, Dr. Khurram. Thank you so much. It was really precise and it was highly interactive. And I think all the audience, the one who will listen later in the recorded lecture, they will also benefit from your points, the one you highlighted.
Okay. I welcome all your questions and discussions. We have time now. We can do it. If you guys have
yes,
it.
Please. Yes. If anyone has any question. Yeah. Please, if you have any question, please just unmute your mic and ask directly Dr. Khurram. And if you want to write in the chat box, please write down in the chat box. Inshallah, next Sunday will be our last lecture and all the presentations will be shared, and the recorded lectures you will find in the YouTube under this forum, Giving Back to Pharmacy in Pakistan. But all the slides, inshallah, we will share by 2 days. And if you need any more reference material or anything, we will try to, because Dr. Khurram, he mentioned that he have exam book. Actually, I don't have this one, so I don't know that these,
I'll share
there was some kind of, yeah, sure. I will just make one link and we can just add in this one.